Dr. Small is a professor and chair of psychiatry at Hackensack University Medical Center. He oversees all professional and administrative activities within the Behavioral Health Care Transformation Service at Hackensack Meridian Health and serves as chair of psychiatry at Hackensack University Medical Center. Prior to joining Hackensack Meridian Health, he was also a professor of psychiatry and biobehavioral sciences and Parlo Solomon Professor on Aging at the David Geffen School of Medicine at UCLA, Director of the Division of Geriatric Psychiatry at the Semel Institute for Neuroscience and Human Behavior, and Director of the UCLA Longevity Center. He's also known for his public work in promoting the practice of psychiatry and innovative research on brain health, aging, and Alzheimer's disease. He is a co-inventor of the first positron emission tomography or PET scan method that provides images in living people with Alzheimer's disease. That's huge, with abnormal brain proteins, amyloid plaques, and tau tangles. In addition to testing compounds that may benefit cognitive abilities and possibly delay the onset of Alzheimer's disease symptoms, he also has studied and developed lifestyle and memory training programs for improving cognition and healthy aging. Dr. Small has authored more than 500 scientific publications, 12 books, including the international bestseller, The Memory Bible. And among his honors are the American Psychiatric Association's Weinberg Award for Excellence in Geriatric Psychiatry and being named the Scientific American magazine as one of the world's top 50 innovators in science and technology. He is a past president of the American Association for Geriatric Psychiatry. Thank you so much, Dr. Small, for taking your time to be with us today.
Well, thank you, Tammy. Thank you, Tiffany, and the rest of you, not only for inviting me to speak to you, but for supporting my work. You know, the invention you mentioned of the PET technology. I will talk a bit about that today and try to show you how this kind of technology fits in with a larger or broader strategy to protect our brains as we age. So let me just get right into it. And I'm just, you know, I like to think about a formula for successful aging, that we really do have some control over how long and how well we age. Just some disclosures about my potential conflicts of interest and the equity interest. This company, actually, Ceremark Pharma, has licensed that technology that your group supported a number of years, over a decade ago. And they're currently working on commercializing it so we can get it out to the public. So, excuse me, just one second. The 19 hospitals have got some things can't wait. So anyway, so you know, you can look at this formula in many ways. I just mentioned here 4 different areas where we have some control over how long we live and how well our brains age. Now, if you look at the whole, you know, the whole area of Alzheimer's disease, it's really been focused on amyloid plaques and tau tangles. These are these abnormal protein deposits that accumulate in the brain as we age. And at a certain point, people develop Alzheimer's disease, which correlates with the accumulation of those abnormalities. Here you see an Alzheimer brain, which is shrunken or atrophied versus a normal brain. And the insets show you where you see these high concentrations of plaques and tangles in the Alzheimer brain. But you also notice in a normal brain, you see an occasional plaque and tangle. And so it makes the point that these issues accumulate over a lifetime. Now, with the PET technology, which functions like a Geiger counter, it counts up radioactivity in the body. And what we do is we inject this radioactively labeled chemical marker, which is attracted to those plaques and tangles. So that's what the discovery was about. And here you can see, you know, here's normal older people. The middle one, MCI, is mild cognitive impairment, sort of an in-between state between normalcy and Alzheimer's disease. And you see the brain gets more yellow as it gets worse. And, you know, if we follow these people up at autopsy, you see the areas of the brain where there's a lot of warm colors, that correlates with the high concentration of plaques and tangles. And we've done hundreds of these studies, probably thousands at this point, and it really correlates with memory score. So as memory gets worse, you see the buildup in this three-dimensional array of the brain. Now, we know that there are different stages of cognitive decline. And so there are really three major stages. If you plot brain health versus age, there's normal aging, when we misplace things, forget somebody's name, doesn't interfere with our lives. If that worsens, we call it mild cognitive impairment, where it's a little more challenging, but we can compensate. And when our ability to compensate for brain aging goes away, that's when we call it dementia. That means that cognitive deficits interfere with our everyday life and our independence. And we can measure these declines with pencil and paper tests, what they call neuropsychological tests, or brain scan that you help fund, and other kinds of brain scans, looking at brain metabolism, for example. The main strategy that we've been supporting over the years, and others are beginning to embrace, is that if we do nothing to protect our brains, it's a downhill slope. But if we can intervene early, we can slow the process down. Yet, most doctors do too little too late. And it's clear that it's easier to protect a healthy brain rather than try to repair damage once it becomes extensive. Now, another thing to consider is when we intervene. And it turns out some interventions, and I'll describe some of the anti-inflammatory interventions, they seem to work when the brain changes are mild, but may not work later. It may even be problematic if you intervene later. Now, if you have someone with Alzheimer's disease and you put them on placebo, they're going to get worse, as I mentioned. We now, actually for decades, we've had what we call symptomatic treatments, drugs like donepezil or Aricept, rivastigmine, galantamine, and so forth, and they result in temporary benefit. But the real thrust in recent years is to look for a disease-modifying treatment that really would change the playing field. One way to think about this, if you have pneumonia and you take aspirin, that's a symptomatic treatment. You have to keep taking it. You feel a little better, but it doesn't cure the pneumonia. You need to take an antibiotic, which will get to the underlying cause and cure the disease. And that's more of a disease-modifying treatment. And the research in that area has looked at vaccines, pills, electrical waves, where you can jumpstart neurocircuitry, even insulin nasal spray, because of studies showing that people with diabetes have a greater risk for dementia and cognitive decline. And there's also been infusions that some have been cleared by the FDA, and I'll talk about that in just a moment. A lot of this drug development has focused on amyloid as a target. That's represented by the red. You can see the preponderance of red dots there in drug development. And unfortunately, I'm a fan of diversifying our research portfolio and looking at other mechanisms of action. If you've been following this in the news, you may know that there's been some hiccups or speed bumps along the way with the development of anti-amyloid drugs. And the first one that was cleared by the FDA, aducanumab or Aduhelm, really went through this, where the first two large studies didn't seem to work. So the manufacturer terminated their trials, but then they went back and reanalyzed the data and thought, well, maybe there's a there. And so they went back, they applied to the FDA. FDA committee, these are outside experts, all said there's not enough scientific data there, but the FDA cleared it anyway. And it created a lot of controversy. The Centers for Medicare and Medicaid Services didn't really fund it in terms of Medicare support. And so that went by the wayside. There have been other anti-amyloid drugs that have actually been cleared, but there's controversy about how much of an effect they have. And they do have a lot of side effects and tremendous costs. Now, what I want to emphasize in this talk is lifestyle as a way to prevent or delay onset of dementia. And the Lancet Commission back in 2020 published this important report where they described several different areas of our lives where we can have some control over our brain health. Some of the areas I mentioned earlier, but even things like avoiding smoking, taking care of your health care, treating hypertension, avoiding traumatic brain injury. What about, let's go into a little deeper dive in some of these areas. Mental exercise, there's been a lot of studies in that area showing that mental stimulation will lower Alzheimer's risk. People who educate themselves, who know several languages, do well. There's been some recent studies showing that cognitively stimulating jobs, using a computer, taking classes, playing games, doing crosswords will protect you from dementia, delay the onset. And then there's something above and beyond the mental stimulation. That's learning memory techniques. And when I was at the Longevity Center, we developed a lot of classes. I've written a lot of books in this area where you can teach people how to jumpstart their memory abilities, their cognitive abilities. And these have immediate benefits. And if you use the techniques, you can have benefits that are sustained for many years. We've even shown using different imaging techniques. This is called functional MRI, where you can see the brain working from moment to moment. When we have people search online, if this is what the brain looks like, the red areas show you when people are searching online for the first time, not a lot of activity, but when they train, when they're savvy at internet searching, you can see there's much greater activity. So even something like searching online can be a form of brain exercise. Physical exercise is also very important for protecting the brain. Both animal and human studies have shown this. If you see that graph in the slide there, you see the top line, there's a group of people, the solid line indicates people who were just jogging or actually walking 30 minutes a day. The control group, the dotted line, these are people who are just stretching. And the metric is the size of the hippocampus, a very important brain region that helps us encode memories. So just everyday exercise can have a huge effect on the brain. Now, the other way of looking at it is sitting. And our group did a study here looking again at MRI and the size of the hippocampus and just asking people how many hours a day they were sitting. And there was a direct correlation between the sitting and the smaller size of this medial temporal region, which is important for memory. So a lot of people like to get on the treadmill while they're doing their work at their desk, but you ought to practice with this because you don't want to fall off the treadmill because you can hit your head, and we'll talk about how bad that is for your brain. And this study we did was a few years ago. A more recent study of nearly 50,000 people confirmed our results that among older people, more time spent in sedentary behaviors is significantly associated with higher incidence of dementia. Nutrition is very important. Midlife obesity increases the risk for late life memory decline. Omega-3 fats are anti-inflammatory. They protect the brain. So fish, nuts are great. Antioxidant fruits and vegetables are also brain protective. And adherence to a Mediterranean-style diet lowers the risk for dementia. It's important. Stress is not good for your brain, and many studies have shown in humans and in animals that chronic stress will impair memory and lead to brain atrophy, but meditation and relaxation, as these functional MRI studies show, can rewire your brain and improve cognition as well as mood. And you don't have to go to India and join a retreat. You can just meditate 10 minutes a day to have a significant effect. We've looked at some of these effects using our brain scan, FDBMP PET, and we found that adherence to a Mediterranean diet, physical activity, even body mass index, which is an indicator of overweight and obesity, directly correlate with the amount of abnormal amyloid plaques and tangles in the brain. Now, I talked about amyloid and tau, which our brain scan measures, but I think what may be even more important to brain health is controlling inflammation. We know that inflammation is a normal physiological response to an infection or to an injury. But as we age, we have too much inflammation, and these inflammatory cells will attack healthy brain cells. So a lot of these lifestyle strategies, one I didn't mention, a good night's sleep, but consuming omega-3 fats, physical exercise, and others reduce inflammation. This may be the relevant mechanism. Over a decade ago, we did a study looking at an anti-inflammatory drug in people with mild memory complaints. And we found that indeed, after 18 months, people who took the drug did better cognitively and had better brain scan images than those who took a placebo. Problem with these drugs is they have a lot of side effects, and we don't want to prescribe them for everybody. And other studies have found if you already have dementia, it won't help, and it may even make things worse. So we've looked at safer forms of reducing inflammation, and one study that was highly significant was looking at a bioavailable form of curcumin, which is a spice from turmeric. And we found at over 18 months, there was a significant improvements in memory and attention compared to the placebo. Now, the issue is a lot of supplements you get at the health food store really don't do much, but this was a bioavailable form. Here's just an example of one of the companies that has licensed this particular compound. We're actually poised right now to replicate this study at Hackensack at several of our sites here in New Jersey, and collaborating again with UCLA. Other things to keep in mind to protect the brain is avoiding head trauma, not smoking, having a positive outlook, and simple ways to take care of your healthcare. Treating hypertension and high cholesterol are very important. Now, in the areas of head trauma, we've done more research using FDBMP, our amyloid tau PET scan. And a few years ago, we started looking at retired NFL players. And after that, we looked at military personnel who had undergone blast injuries. So football players have a risk for developing chronic traumatic encephalopathy, where there's not only a cognitive deficit, but there are personality changes, mood changes. And you can see by these patterns on the FDBMP PET scan that comparing the control to an Alzheimer patient, to a football player and military personnel, you see differences in these patterns. And what's interesting, the football players and the military personnel, they have an area that lights up called the amygdala. And it's an emotional control center, which may explain why these individuals not only have cognitive problems, but emotional problems as well. And with George Barrio, our lead chemist, we've done extensive studies. And this is just a diagram showing you the green represents people with suspected chronic traumatic encephalopathy or the head trauma. The blue represents healthy aging, and the red are the Alzheimer cases. And you see, depending on the brain regions you're looking at, you can really separate these three groups. And so we think this is an important tool that will eventually be commercially available, that will help differentiate these conditions, help with more targeted treatment. And the FDA has given us very good guidance on how to do the studies, to look at people with mild cognitive impairment, do a baseline PET scan, and then follow people for 2 years and see if those baseline PET patterns will predict outcomes better than clinical assessment at baseline. So to summarize, I wanted to give us a few minutes for Q&A. Look, drug development is important. It's key to the future of Alzheimer's prevention treatments. But we don't know how long it's going to take to really get effective and safe treatments at this point. But for the average person, non-genetic factors have a greater impact on how well their brains age, more so than genetic factors. And several of these lifestyle behaviors, healthy nutrition, brain exercises, mental stimulation, physical conditioning, stress management, have a greater impact on how well our brains age than people realize. Now, the challenge is developing programs and incentives to motivate people to live a brain healthy lifestyle. And so we're working on that. And that's where the many books that my wife and I have written on this, the programs we developed at UCLA come in play. So let's stop there so we can have a little time for discussion. And let me just thank you for your attention.
Thank you for the presentation. I've been doing a lot of podcast listening and research lately because I'm going through the early diagnosis phases with my mother with early onset dementia. She's 64, and we do have Alzheimer's in our family and a pretty clear genetic pattern. Her grandmother and her maternal aunt both died of, just symptoms of Alzheimer's. and she is already been diagnosed with cognitive impairment, and we're getting PET scans next week. And she's on a couple different Alzheimer's medications already. But I'm thinking for purposes of myself, and I'm really involved in Rotary and starting to learn more about how I can advocate for CART. But from a research perspective, how can someone, I'm in my mid-30s, in addition to the lifestyle changes, are there early diagnostics that someone like me could do for genetic markers and things of that nature to be more proactive?
So I think let me tell you a couple of things. First of all, people with a family history are always going to be anxious about this more than the average person, and it does increase your risk. My wife has that family history. I know every time she forgets a word, we get a little anxious about it. But having said that, genetics is not the whole story. We did a study many years ago with identical twins. One got Alzheimer's, the other did not, and there's a huge difference in their lifestyle. So, and many of the other studies with larger samples that we've done, we found that even if you have the genetic risk for Alzheimer's, these lifestyle strategies can still mitigate the problem. Now, getting to your question, should I get these tests? I generally don't advise people to get it. I mean, I guess the one area you might do it, you had an extensive family history. Now, there's a possibility you have what's called an autosomal dominant inheritance pattern in your family, which would mean that these are rare genetic mutations that cause the disease. So you could go to a genetic counselor and ask, is this pattern? You get tested, and you could find out if you're going to get Alzheimer's disease. For most people, that's less than 1% of the cases. Even with your family history, it may not be relevant. I don't know. For most people, there are genetic risks that don't really tell you enough what's going to happen. Now, the downside of getting the genetics or getting the brain scan at an early age, if you don't have symptoms, is that it can make you anxious and can make you even more worried. And there have been studies showing if you compare people, let's say, who are carriers of a genetic risk, who are informed about their genetic risk, they do worse on memory tests than people who have that genetic risk and are not informed about it. So, you want to think about that. You might want to start, if you're really serious about it, talk to a genetic counselor. I generally, even though I'm in the brain scan world, I'm very conservative about using these technologies to see where is it going to have a practical application.
I was wondering what your favorite personal mental exercise is, Dr. Small. What's your favorite for you personally?
I'm like I'm LA Times Sunday crossword puzzle.
Okay.
And I do a lot of. I just enjoy. I have like a routine every day. I play words with friends. The New York Times has a bunch of puzzles, Wordle, connections, and I kind of go through this. And we actually have a group of people, my daughter, son-in-law, and my couple of other friends, my wife, and we're playing and sharing our scores every day. So it's a lot of fun. Now I was doing the puzzles since I was a kid. My father was into it, the whole family was into it, and I always just did it because it relaxed me and it's fun. But
sure,
recent studies are showing that it actually does protect your brain. So maybe that's why I'm here talking to you
today. Thank you.
Yeah.
Dr. Small, we had a question in the chat about how would someone look into becoming a brain tissue donor?
Well, I think the best way to do it would be to go to your local university. If they have an Alzheimer's center, they generally have a brain bank and a neuropathology course. I would start out with the university programs that usually have these opportunities. There's so many projects in the works. Well, we're actually working on developing a brain supplement that we hope to have come out in a year or so. My wife and I are working on some other ideas for a new book. In the study realm, I mentioned the replication study for that first supplement study we did, curcumin. You know, one interesting project, I have a meeting a little later today, looking at how the COVID vaccine affects risk for developing Alzheimer's disease. You know, I think another important area of study is how social media is affecting behavior in the brain. You know, we're seeing a real uptick in kids with lots of behavioral problems. And sure, a lot of it was the isolation from the pandemic. But if you look at the trends in social media use, it's really very, it causes a lot of psychological harm in these kids. So I think those are just a few of the areas that we're excited about. And a couple other things. We're developing a psychedelic research center. This is kind of, I don't know if you've been reading about this in the news, but there have been centers, and actually a lot of the academic centers, Johns Hopkins, Harvard, and others, have developed these centers where they take MDMA or psilocybin in a controlled therapeutic situation, and they find people with treatment-resistant depression, post-traumatic stress disorder, really has an impact in their lives. So we're taking this very seriously, and we're looking at it. And the final one is I actually have a meeting shortly with people I'm trying to recruit to New Jersey to develop a digital mental health center. So, a lot of psychotherapies right now are evidence-based, where, there's actually a formula for doing the therapy, and they've been shown scientifically to have a benefit. Well, these scientists and engineers have taken these evidence-based therapies and put them into apps and into video games, so people can get treatment and they test them and they really work. And this is a great way to get more people access to treatment, because there's just not enough mental health professionals around.
We have two other questions, if you can get to them quickly, that were in the chat. One is, do you have any recommendations of any over-the-counter brain supplements that you believe are effective currently?
Well, I showed that Theracurmin, Better Brain Health, that's one version of it. There's a lot of companies that license that. I think that Neriva makes one. It's also a company I've consulted with in the past that has phosphatidylserine that has something in it. So those two come to mind. A lot of this stuff has not been tested scientifically, but there are a few that have.
And then also, finally, you made the comment about children and the effects of social media. What about the uses of iPads and other technology? Do you think that is going to have an effect eventually as well?
There's mixed effects. In fact, my wife and I wrote a book called iBrain about this a number of years ago. And if you probably search me on the internet and look up this topic, I've done a lot of interviews on it and lectures on how technology is both good and bad for our brains. It's a mixed bag. I was actually just in an international conference in Europe speaking about that, where they take it very seriously. There's a conference that included educators, politicians, and in a lot of countries in the European Union, they're restricting social, phone use among the younger kids, especially in schools. Anyway, I got to run. Great to see all of you, and keep up the good fight against the disease. I really appreciate it.
We appreciate you spending some time with us today. Thank you, Dr. Small.
Thanks.